Eric Feigl-Ding is a senior fellow at the Federation of American Scientists, and he joins us now from Washington. Thanks so much for being with us. You know, I've found myself getting frustrated reporting these numbers because of the lack of per capita context. I mean, we so often focus on the headline numbers rather than what they are relative to population. Have you found that misleading as well, for example, when you talk about massive infection rates in India, for example, but fail to mention that that country has a population of over 1 billion people?
Right. And happy to be here to explain. This is a very tricky issue because there's so many factors. Early numbers from March and April are also not comparable to now because right now we have more testing. But at the same time, you also have to look at positivity in terms of what percentage of tests are actually turned positive. That's actually one of the best indicators. But at the same time, number of absolute cases is really key because I would be much more fearful of 100 cases in downtown Manhattan, New York, than in rural America, because in New York, the density allows it to spread even further. So there's different reasons to look at different ways. And a lot of US cities, Miami right now, if you break it into per capita, would probably be one of the highest in the world because of the density. So if they are all important in their different ways to look at it, but if a country has rural areas, it lowers it somewhat. And so this is why we have to look at all the different ones.
We do, but there seems to be this opportunity to present it to leaders like Jair Bolsonaro or Donald Trump, who like to say, you know, look how the press and how our health experts are misrepresenting the numbers because actually we have lower per capita death rates and infection rates than almost all, you know, infected European countries, yet the fake news keeps putting us at the top of the headlines. So is there a danger when we really don't take the per capita statistics into priority consideration?
Right. There's, as you know, there's the saying is lies, damn lies, and statistics. But statistics do tell the truth when you look at it in the right way, but it can be definitely abused. And I think I want to point out what's more relevant per capita is daily per capita right now, rather than cumulative, including all of the past. And right now, the daily per capita, it tells you how big the current epidemic is. And Trump's excuse is, well, it's just testing. No, the cases are going up faster than testing is going up. That's why we know this epidemic is truly growing. So it's more than just per capita. You have to look at positivity and how much it's growing faster than testing.
Right. And I mean, to that, when you look at European per capita death rates, as well as, you know, New York City, for example, you do get the most frightening numbers, but followed by a serious flattening of the curve. I mean,
That's
what?
right.
Is it only when thousands die that governments will really take it seriously?
Unfortunately, sometimes that is a cynical view. Europe right now, for example, you mentioned Spain. Spain had a high death rate, but right now it is very low compared to the rest of the world. But deaths are a lagging indicator, and the problem is that they lag anywhere from 3 to 4 weeks, maybe 5 weeks after you first diagnose these cases rising. And that's the problem. Sometimes people want to wait until the hospital beds are full and the death statistics go up. But that's very silly because, you know, should you not wear a seatbelt or wear a helmet just because you have hospital beds free? No. We should look at the cases rising as the canary in the coal mine, not just waiting for deaths to climb.
Okay. I mean, I guess what a lot of people are also paying attention to when they can, and they're taking maybe false confidence out of this, is when they do see those hospital beds empty. I mean, one of the indicators I've seen here, I've actually heard people tell me everything is fine because there's so much hospital space. And right now, the hospitals really aren't struggling with numbers. Now, I know Turkey did take a lot of very serious measures in order to get the virus out of control, and we are seeing some of the upside to that. But still, there is a problem, is there not, with people thinking that whatever's happening in the hospitals is the real indicator of whether or not we're okay?
Yeah, that's very true. Because you have to realize this epidemic, this virus is so pernicious in spreading that over 50% of the cases are actually now regarded as asymptomatic, pre-symptomatic. And so even if your hospital beds are full or free, that doesn't mean the virus isn't spreading, because 50% of the cases can be asymptomatic, and it keeps fueling in the background. Also, for the record, hospital beds can be easily increased. The problem is that, oftentimes doctors and nurses demand and staff those hospital beds are not. So we can not just look at deaths or hospital beds. We actually have to do test, and isolate people early and contact trace. That's how you defeat an epidemic.
And we need to keep wearing those masks and maintain that social distance and wash those hands. Simple enough measures. Let's hope people keep taking them seriously. Feigl-Ding, thank you so much for joining us.